Aging is a twofold process. It's a loss of subcutaneous fat,
Yes.
okay, but it's also a shrinkage of the bones. And we didn't know that until MRI scan, magnetic resonance imaging scanning was the thing that helped, because that MRI came in. I was still in general practice when MRIs came in, so that's late sort of late 90s. And so there are people around who are in their 20s and had MRI scans of their face that were still available because it's digitized and all that sort of thing. So they were actually able to take sequential MRI images of the same person. You could actually see the bones changing shape and moving position, particularly the mid-face bones.
Jeez.
So, sorry.
All right, so there's not much you can do about that.
No. Well, you can hide it by putting fillers and things in it.
Welcome to the ATP Project. You're with your hosts, Steve, Jeff and Dr. Doug. Dr. Doug, how are you?
I'm exceptionally well. Thank you for having me here to chat.
How do I know you? That's right.
Well, perhaps people should know that we're sort of related by law, if not by biology.
Well, it certainly wouldn't be by choice, Dr. Doug. So, I still am amazed that Beck let him in. So, and I guess you couldn't say anything. So, yeah.
I could tell you the story of our first meeting, but I won't.
Maybe later.
Okay. Wow. Is it R-rated, a bit blue, is it?
Not at all. No. It's actually about acne, so it's sort of relevant to today's conversation possibly. But
hang on a minute. Well, we know that Steve's 360 years old. So, I mean, if you were treating him for acne, how old does that make you, Doug?
No, I think it's a good fun way to start the story. So we just explained that Stephen is my son-in-law. He's married to my wife's daughter, and he came over, had to be introduced to Mum, and so Steve came over to our home for dinner. And that's how we first met. And I remember thinking, Steve's background is naturopathy, and medical profession and naturopathy have often sort of fired bullets at each other. And I thought it's going to be a potentially awkward or unusual evening, so I was sort of prepared. So anyway, somehow or other, the conversation is always with me drifted to acne, which is definitely my passion as a doctor. And
that is your passion?
Oh, absolutely. Yeah, I'm very passionate about acne. I'm passionate about medicine generally, but acne is my particular passion because it's so harsh on people. It really is, very much so. Yeah. So anyway, I was sitting at the table with Steve, and something that comes up, and Steve said, that's quite easy to fix. And I thought, here we go. And I said, tell me about that. And he said, it's just the diet. And I said, okay, tell me about that. And I had a whiteboard. So I brought the whiteboard in, and Steve got up to this whiteboard and drew out all the chemistry of the effect of carbohydrates inducing insulin growth factor 1.
Wow.
Without notes.
Yeah, no.
This is a guy I need to take seriously. And then the second part of the story is one of the papers that Stephen then gave to me, because I was going to Bali, if you remember. Yep. Steve got this paper out for it. It was about 7 or 8 pages from a German guy that he and I both follow. And I promise you it took me 6 hours to read it because the chemistry in it was so high level. Wow. And I had to read it over and over again to get it through my head. But once I finished reading it, I became a believer.
Yeah. Yes.
And that's how I started using diet as part of my management of acne, and there's some lovely stories about the success rates of that, which we might get around to talking about.
No, I love that as well too. And the fact is, how old was Steve when he started sequestering? I'm not sure really what the word is. Bamboozling your daughter?
Well, there's a bit more to the story though, which I didn't know at the time until Gail produced a photograph.
Yes.
Steve used to be a busker down at Coolangatta.
Yeah.
And Gail's oldest daughter would not infrequently invite him because he looked starving.
It was a muso.
He's a starving man. He used to invite him home and feed him because Gail's an exception. My wife Gail's a great cook. Yeah. And so they knew Stephen personally. Wow. And Rebecca and Steve were sort of friends on Facebook. And
hang on a minute. So what's the difference between you and Beck?
10 years.
So you would have been 24 and she would have been 14?
I wasn't dating her then.
No, there's no dating. Yeah.
No.
They knew each other.
I knew her older sister.
Well, so you dated her older sister?
Well, we were just friends more than anything, And
I better stop talking.
Megan's she's closer to my age. She's about 3 years younger than me.
No, I don't ask me off the top of my head. I'd have to look it up.
Probably 4 or 5 years younger than me.
Yeah, that's cute.
But that's when I first met Beck, when she was probably 14 or 15.
Right.
I first met her.
Yeah.
And then later in life, we caught up on Facebook probably 10 years ago or something.
Yeah.
We re-met or something, and then we started dating and got married.
You invited her out for dinner.
I remember what happened. Yeah.
So how long have you guys been dating for now?
Beck and I, if I say 10 years.
About 10 years. I've known Steve quite a while now.
Yeah.
And coming back to your story as well too, it's fantastic actually to listen to doctors that are And obviously, Doug, this is why you're on the podcast, because you're open-minded. And we always say question everything, right? Because ultimately, science leads to the truth, and the ability for, and I appreciate, and I don't want to use terminology that's not correct, but I always look at integrated doctors and people who actually look at different modalities and can take learning from that, as opposed to obviously being, very rigid in their views, and anything outside of that is they're not prepared to entertain it. So that's fascinating that you've had some obviously discussions with Steve, the hippie, who's also trained in chemistry, and naturopathy as well too, and then you're able to actually sort of learn from that.
Well, I think we learn a lot from each other, because Steve is without wishing to butter his bread too much for him, is a great researcher. He's really incredible, the things that he digs up out of places, and he's always sending me stuff to read. And I think like I've only got 400 emails to clear, and I'll be there, sort of thing. And we banter backwards and forwards about the papers, and sometimes I'll pick up things in them that Steve doesn't pick up from my medical background. And I'll say, actually, this is very interesting, Steve, but did you see this part? And that's rubbish. And this is why it's rubbish. So we have it's a wonderful friendship that we've got, because it's professional, but it's also personal. You know what I mean?
Well, and that's why it should be. I mean, again, you don't have to agree, and this is the thing. I think everybody feels like unless you agree, you're actually mortal enemies. But it's good to have that juxtaposition or coming thing. And actually, no, I don't agree with this, and here's the reason why. Because that's how you get to the truth of the matter.
Absolutely.
Right? So, Steve.
Yes.
Why is Dr. Doug here after that personal introduction?
Well, we should ask who he is too.
Yeah, go on.
Well, you've been a doctor for over 50 years, almost as old as I am. That's a long time. So how did it all start, and where did it all start?
Obviously medical school. But,
in Sydney?
Look, in Sydney, yes.
Yeah.
I went to high school in Sydney, and much to my school's absolute amazement, I did all right in the final exams, because I wasn't considered to be any kind of scholar. I was a jock, it's always what sports season are we know? Yes, we're doing cricket at the moment. I managed to get a very high score in the leaving certificate, and interestingly, not in any of the sciences though. I came 10th in the state in modern history, as I recall. So, because we had a brilliant modern history teacher. But anyway, I got into medicine, but I really didn't. It wasn't like this. I've always wanted to be a doctor stuff. It wasn't like that for me initially. But as I progressed through it, I got it and understood what I get emotional when I talk about things like this. I think being a doctor is one of the greatest gifts that you can ever be given. You have been given the gift of being able to help people and change their lives for the better. And that's an amazing gift. And I get very angry if I see any doctor who misuses that and does it for personal gain or fame or whatever. All I care about is helping people. I know it sounds like I'm trying to beating my own drum, but I mean it. I like helping people. I really get a lot of pleasure out of it.
No, I remember last time that we spoke and you were talking about, I can't remember, it was an affliction on a woman's face. I'm not sure if it was a mole.
Yeah, we're going to talk about that one. We'll talk about it now if you like.
Let's do that. Because I just remember, I can't even remember the exact story, but I remember the passion because you genuinely care about people. And I think that's the thing that cuts through. Because you genuinely want the best for that person.
Absolutely.
And I think, that in any healer, whether it's quackery,
do you look at me when you say that?
I do, Steve, because you remind me of a duck. But whether it's, whether it's accepted Western or whether it's, Ayurvedic or Chinese or what, people typically, the ones that really get the best results are the ones that have a deep connection and passion to actually heal and help. And again, that's what came across, when we were talking about this. Please tell the story because I actually can't remember. I just remember the emotion.
It's quite a few years ago, probably now it'll be 20 years ago, the story. But one of the techniques that I brought back to some extent by accident from America was a method for taking moles off that didn't involve cutting the mole out, but rather shaving the mole until the skin was completely smooth. Okay. And the benefit of doing it that way is if you cut skin, generally you will leave a scar, albeit plastic surgeons are sometimes really good at hiding scars and making them very hard to see, but you will leave a scar. But with the shaving technique, you don't. The only issue with the shaving technique basically is the potential the skin colour will not necessarily match the surrounding skin at the end of it. They usually do it, particularly on the face.
Right.
But on the chest and back, they tend to be paler.
Right.
But people just want to get rid of the mole. They just don't like the look of them.
Yeah.
And the story is that this lady presented to me, and she was mid-20s, quite an attractive young woman, except for one thing. She had a mole called a strawberry nevus on her cheek.
Yep.
And a strawberry nevus is a mole, but it's very red in colour. And in her case, it was probably the size of your thumb, roughly, in size. And she wanted to know whether I could, help her. And I said, yeah, sure, I can take that off for you.
She had that since birth, Dr. Doug?
Pardon?
Since birth? That was there since birth?
Yes, birth, yeah. Got bigger with her. So it was seriously thumb size. That's a big mole. Have right on your cheek.
Yeah.
Right in because when people look at each other, they look in their eyes or the mouth. So they're always going to see something like that.
Yeah.
So anyway, I did the treatment on her. It's quite easy to do, just do it on a local anaesthetic.
Yep.
And as was always my custom, I sort of walked back to my desk and to write some notes. And I always hand the patient a mirror and say, have a look. Don't worry that what it looks like now, it won't look like that in 4 weeks' time. That's what it looks like when I'm finished. Okay? So I went back over to my desk and sat down. The next thing there's this, and I traced her. I said, what's wrong? She said, you cannot believe how I hated that thing so much. And she said, I cannot believe that in a matter of 5 minutes you've made it go away like that. She just, I cannot believe it.
Wow.
And it was like, wow.
Yeah. That's life-changing.
That's life-changing. So I said to her, would you be kind enough to come back and see me in 2 months' time? I'd like to see the final result. And she came back to see me, and it was a brilliant result. I was so pleased. It was perfect.
Yeah.
The skin colour was right, and it was completely smooth and all that sort of thing. And she said to me, you changed my life.
Yeah.
She said, I spent all my life talking to people with my hand on my face, kind of cover up the mole so they couldn't see it. And she said, now I don't have to do that anymore. She said, you don't realise the change in my life since you did what you did.
Yeah.
And I mean, man, that's just the greatest gift.
Yeah, it is. It's funny, isn't it?
Yeah.
I think, and people
give me that anytime.
In terms of, I guess, beauty and skin, and Steve and I were talking about that, saying it's a fascinating area, and there's so much science, there's so much help for people, and we're talking about Botox, and Steve said, actually, Dr. Doug knows the original guy that invented that.
Well, they
brought it to Australia.
Oh, I know.
Yeah.
I know.
You've got to tell the history.
Okay. Yes, okay. I'm happy to tell the history. The story of Botox was two Canadian doctors, Alistair and Jean Carruthers, both doctors. Jean was an eye doctor, an eye specialist, ophthalmologist.
Yep.
No, and Alistair was a dermatologist. And we're talking now sort of late 80s. And Botox had actually been around for a while, but I'd never heard of it, I must admit, until about 5 or 6 years before that, when I had a patient who had what's called blepharospasm. It's twitching of the eyelid. I don't know if you've ever been super tired and your eyelid starts flicking on you.
I have actually had that.
Okay, it's called, if it happens 24 hours a day, 7 days a week, it's really, really annoying. And it's called essential blepharospasm. And Botox was perfect for it. It's quite interesting actually going back and look at some of the old papers. I can't believe the doses they used. They were massive.
Right.
These days, it's a tenth of the doses they used to use.
And it was used to treat that sort of blepharism.
Yes, exactly. Stop the eye from twitching.
Yeah.
In some cases permanently, but most cases needed to be retreated. But typically blepharospasm only affects one eye. Okay, so the patients will come to inject. I should explain. To inject blepharospasm, you have to inject around the outer edge, not of the eye, but of the the bone or the skin out in that area, muscles out there that's causing the trouble. And so they'd only just inject the one side. And people used to come back for their 2-week check to see whether it was working or not, and they'd say, "It's really great. I'm really happy, but could you inject the other side for me? All the lines on my face have disappeared on that side, on the other side. The skin's lovely and smooth." And so Jean obviously is telling Alistair about this, and they both sort of think, maybe we're onto something here. And so they start doing some research. And initially all the research was done on the lines around the eyes, though that's not the most common place to treat anymore. But that's where they did the research.
Most common place to treat?
That's called your glabella, the area between your eyebrows, the frown lines. Those vertical lines there are called the lion's lines, as in growly lines.
Actually, you don't have very many lines there. Have you been?
No, I don't. Well, I don't frown a lot, but I raise my eyebrows a lot because I'm a typical bloke. I've got brow ptosis.
Yeah.
So you raise your eyebrows all the time. So that's how it started. Okay, they basically started researching it, and then they eventually published. And Steve and I have been trying to find the paper. We haven't found it, but I think they published about 1989 on the cosmetic use of Botox to prevent wrinkles around the eyes. And from there, they expanded into other uses, which was forehead lines and the glabella, and so it goes goes on.
Look at it now.
But I guess we talk about Botox, but what is the most common procedure you see?
Within Botox or within cosmetic medicine?
Within cosmetic medicine.
Botox,
Yeah.
definitely. Let's just stop for a moment and talk about the word Botox and get
Okay.
it so we're all on the same page.
Yeah.
It's trademark, right?
Thank you. Botox is a trade name.
Yep.
Okay, it belongs to a company. Allergan sold themselves to. I can't think of the name of the company now, but anyway, it used to be Allergan. But the actual active ingredient in Botox is botulinum toxin. Okay, so let's preferably use the word botulinum toxin, so
Yes.
we're not covering trademarks here. Okay,
Yeah.
and just so everybody knows, there are in Australia 3 versions of botulinum toxin that you can use. One is called Botox,
Right.
a trade name which is fiercely defended by the company that owns
bet.
it because it's almost a household name.
It's kind of like, in New Zealand we say, get the chili bin, or you
chili
say
bin, yeah.
get the esky, right?
Yeah, yeah.
It's like that's actually a brand name. There's a few things where it becomes synonymous with
Correct.
because
It's like Kleenex tissues.
Exactly
Yeah.
right. Yeah, and Glad wrap and all that sort of stuff, as
Getting
opposed to
Coke,
cling
yeah.
wrap. Yep. So yes,
So there's 2 others. One's called Xeomin, spelt with an X, Xeomin,
Right.
and then which is made in Germany. And then the third one is a product called Dysport, which is made in France, to my recollection.
Okay.
The thing that I think, if we're seeing this as an information podcast, I think there's something that people need to understand about the 3 products. Basically, Xeomin and Botox are 100% identical to each other in virtually every way in relation to dosage and strength and all that sort of stuff.
Right.
Whereas Dysport's different. Okay, and it's not different because it's a different stuff. It's different because it's tested in a different way.
Oh.
Because this is not something you measure in grams. You measure it in units.
Right.
I'll distress people. I'll tell you how the units are measured, so we won't go there.
Oh, okay.
But just
Why?
well, basically, they inject it into a mouse inside the abdominal cavity, and it's the dose that will kill the mouse. Basically, if I've got 1 unit of Xeomin or Botox in this hand, I need to have roughly 2.5 units of Dysport.
Really?
Okay. When we first came out, it used to be 3, but it came down to 2.5. And this is the tricky part about advertising, because people quite commonly advertise. I hear it quite a lot down on the Gold Coast. 100 units of botulinum toxin. The question is, which one?
Right.
Because if it's 100 units of Botox, it's 250 of Dysport, which is a lot.
Yeah, right.
If it's 100 units of Dysport, then I can't quickly do the maths in my head. Steve will be faster. It'll be 40, thank you. It'll be 40 units of Botox, not 100.
Stop it.
You get the idea?
I do.
So
I mean, my question to you is, and again, I appreciate you're not paid, sponsored or anything, but do you have a preferential between which one, or are they both the same, but you just have to use a bit more on the other one? Is there one that's better than the other, in your opinion?
yes,
Which one?
Dysport.
Right.
That's what I always use.
Yeah.
I've been using it for 22 years.
Wow. Again, it kind of reminds me of the story of Viagra a little bit as well too. It's sort of by accident that they found that it obviously had this effect and became a huge industry, right? I guess there's probably a few stories like that.
Oh,
But
yeah.
yeah.
Lots of drugs that had one use that was subsequently found to be very effective in another place where nobody would have even thought of.
No,
One that
that's
comes
right.
to mind is Spiractone.
Oh, yes.
Spiractone, which
Spiractone,
is basically, Stephen's the chemist that blocks antidiuretic hormone,
Yeah,
doesn't it?
antidiuretic hormone, yeah.
And
So-
basically it's quite effective in treating acne.
Yep, and also hair loss as well too. I've heard
and
as
hair
well.
loss, yeah.
Because is it to do with DHT?
Yeah.
Yeah, it's funny because I had of spironolactone when my hair started thinning out, looking at different things to actually use,
Yeah.
and I looked at spironolactone or spirulactone, depending on. I think spirulactone.
But the only thing is that in men, you've got to be careful because it blocks testosterone.
Testosterone.
A droopy dick.
Well, boobs,
Yeah,
the whole
we
bit.
say?
Yeah, well, we've seen that. Well, we've seen that before. I mean, Steve's seen quite a lot of it.
Yeah,
but
not experience.
you don't want to know where he goes night clubbing. But in terms, though, that's exactly right, because I think with guys, I had a guy that came in one time to my retail store when I used to sell supplements, Doctor Doug, and he had very thin hair, but he had a whole coating over the top of his hair, right? And I think he must have been using. Now, I get it messed up in terms of the trademark, Propecia, Prosco, whatever the actual active is. Finasteride, yep. But he had boobs. And I'm like, is the hair worth getting the boobs?
Man boobs. Well, you're going to get them anyway. But no.
No, I don't think so. I mean, I reckon go all Dr. Picard, right? I mean, like he was a bit of a stallion.
He was.
For people that don't know, that's Star Trek Next Generation.
Yep. Let's go back to the cosmetic world.
Yes. Okay.
What are some of the, for any sort of cosmetic procedures, what are some of the complications that you see with procedures? Like which procedures have the most complications?
What about most complications? Because it depends on the person it depends on who did the treatment and to some extent the patient. So let's talk about Botox. We've just been talking about, we shouldn't use that word, should we? Botulinum toxin.
Yeah.
Let's talk about botulinum toxin. It's just a good story too, actually, because it involves the founders of the cosmetic use. One of the most common complications of using botulinum toxin in the face was to get a dropped eyelid. It's called a lidosis.
Right.
In other words, the muscle that basically elevates the eyelid and keeps the eyelid open was weakened by the Botox, because that's how the botulinum toxin, because that's how it works. Okay?
Permanently or just?
No, temporarily.
Right.
Okay, let's quickly do this one.
Yeah.
There is basically no antidote to botulinum toxin. Okay,
Right.
If you have a problem, you just got to wait for it to wear off.
Right.
Which it always does.
Yep.
Okay.
Including death? I'm just kidding.
Well, we don't kill people with botulinum toxin by injection.
Only if you eat it.
Only if you eat the bacteria. Yeah. Yes, there was very common to get. Not very common. Sorry, that's not true. It was not unusual to get a dropped eyelid every now and then, and it wasn't. Nobody seemed to quite know why it happened, and it was actually, with modesty, I was one of the people that discovered the reason, and it had to do with the injection technique. It was the Carruthers injection technique that was the problem.
Right.
Invented.
And that's the people who invent it, right?
Yeah. The essence of the deal is if all people listening to this podcast put their thumb sort of roughly in line with their pupil, so put your thumb about there and have a little feel of what's called your orbital rim, the bone, roughly where you can see my thumb. You should feel a little bump, a little dip. Can you feel a little dip in there?
Yep.
Okay. That's called your supraorbital notch. Okay. And that basically has a vein, an artery, and a nerve which go through it, which comes from the back of your eye, comes up and goes up over the bone.
Yep.
All right.
Yeah.
And the technique that the Carruthers taught, which was a terrible technique, and I still hear of people doing it, was to basically get your syringe and you would actually come in at 90 degrees, so it's directly in this way, until you hit the bone, and then inject.
Holy cow.
Exactly. Well, the reason why you don't want to do that is because it hurts like hell.
Yeah, I can imagine.
Bone is very sensitive stuff. It doesn't like being touched. But the more importantly was if you came down a bit too low, your needle could get into that notch.
Wow.
And that would allow the fluid to get into the eye, because that's where the muscle is that moves your eyelid.
Right. Right.
It was purely a technique thing.
Wow.
Okay. And as I say, I certainly worked it out myself, accidentally, in fairness. I was at a conference and there was a doctor presenting a case who got dropped eyelids both sides.
Oh, wow.
And she actually did a demonstration of her technique. And as soon as I watched the technique and saw what she was doing, I thought, that's what it is. I know what it is. And from that moment on, I totally changed. I didn't do it that way, by the way. I used to do it differently.
Yeah.
I always came parallel with the surface of the bone and also pull the brow right up so that you're way away from that notch.
So when did you first start administering botulism?
1996.
Wow. So you would have been one of the first around?
I can't claim to be the first.
In Australia?
No, I would have been one of the first. Probably
on the Goldie, was it? Or Sydney?
No, it's on the Gold Coast. I probably was in the first 20. I think, the guy down in Sydney, whose last name I'm going to forget, George, who always claimed to be the first person in Australia to use Botox for cosmetic purposes.
Yeah.
But I would have been in one of the. When I first started cosmetic medicine, there were probably about 15 people doing it full time, maybe 20.
Yeah.
It was a very uncommon occupation.
Yeah.
You're still doing it today.
Yeah, still do it today. Can't
Mondays.
stop. I'm a baby boomer. I can't stop.
Well,
I'm going to keep going.
Yeah. And that would be the most prolific treatment that you do.
Tox.
Dr. Doug?
Absolutely.
Yep.
Yeah, that's the most common by a large margin.
And the average lifespan of using that is about 3 months before people come back?
Yeah, that's just typical. There is actually a thing called the longevity effect, but which is interesting in itself. Again, I've given papers at conferences on this subject as to why do you get the longevity effect? What is the mechanism? And the answer is interesting. We were all taught that it was because the muscles got weaker. If you continue to put toxin over a while, because they're not doing anything, they just get weaker and weaker. Not true. The muscle's still perfectly fine, thank you very much. It just doesn't do anything, it just sits there. The reason's got to do with the brain. Okay, you've got to think about how muscles work. So brain sends signal to muscle, says to the muscle contract. That's the only signal it can send. It can't send a signal saying don't contract. It can only send a message to say to contract.
Right.
Okay.
Its natural state is to be
at rest.
Makes sense.
Precisely, it's at rest. The muscle stays in a state of relaxation unless acted on by the nerve to make it contract. Okay. So when the muscle contracts, it has sensory nerve fibers in it which measure the movement, and those sensory nerve fibers send a message back to the brain saying, "I've just moved for you. Is that okay?" The brain sort of says, "Great, that's still all working. That circuit's intact. Everything's fine." Now you put botulinum toxin in there. And all of a sudden, the signal doesn't go back to the brain, and it's a computer. I mean, it's a programmable computer. So after a while, it sort of says, that circuit's obviously wrong. And so it takes it off the list.
Yeah, right.
And people will tell you that they just don't frown anymore. And my classic story of this is a lady who came in to see me, and she'd been having it for many years, and she came and said, I must need some. It's been 18 months since my last injection. And I'm thinking, okay, well, let's have a look. I say, frown for me, which is the muscle that I'm talking about. And you could see her do that classic thing when people try to remember something. She looked up like this now. How do you frown? She couldn't do it.
Wow.
She did not know how to frown.
That's awesome. And the next question I want to know.
Yep.
Is there, and it's been out for a long time now, and I already know the answer to this question, but there can't be any long-term negative side effects of using this, can there?
Look, I mean, I've been using it now since 1996, so I think, I reckon I've got a fairly reasonable batting average on long-term adverse effects, and the answer is no.
Nothing.
Which is interesting, isn't it? I mean, the thing that fascinates me the most about Botox, or botulinum toxin, is that it's a protein.
Yeah.
So why do people get allergic to it?
Well, I was going to say, it would be remiss of us for people that haven't heard that aren't as old as us, that, botulism, you always heard of that.
Yes.
I mean, again, when it first came out, it's like, that stuff will kill you, because, and you said it had to be ingested, correct? And it was something back in the dark ages, pretty much.
Well, yeah, it's from meats, and there's stories about Botox.
Tinned meats in particular.
Yeah, tinned meats and
contaminated tinned meat.
Yeah, and it comes from the word sausage. Weirdly, I didn't know that until recently.
I thought you knew everything about
that.
Sausage expert.
But I was reading a paper on the history of it, and the first title of the paper says, this is one of the most toxic things known to man.
Wow.
Yeah, and it's like the first, I went, well, let's inject that in your face. I mean, it just sounds like
it does, doesn't it?
It sounds like a leap, but it doesn't have any of the side effects. It's incredible.
Right. Well, there you go.
But the difference, of course, is between the food poisoning with botulism and the botulinum toxin injections is that they're very low dose and very localized. Yeah. Whereas when you ingest the bacteria and it starts reproducing in your belly and blah, blah, blah.
Yeah.
But there are other treatments too you do too, like lip fillers and
there's lots of other things, cosmetic treatments. I think you should go back a step, though, first of all, and say the most important cosmetic thing that people can do is skincare.
Yeah.
Okay, now by skincare, I mean basically two things, okay? The first thing is protecting from the sun.
Yeah.
The greatest cause of people having wrinkles and blah, blah, blah is sun damage.
Yeah.
And, I hope that this is not taken offence by the lovely young ladies, but I used to work up at Paradise Point at one stage and drive along the waterfront, and there'd be these gorgeous young girls wandering along the waterfront with tank tops on and no hat.
Where's that?
Having their morning walk. And it's like, I used to say, future business.
Oh, yeah. That's it. Well, Steve, that was me. But I wasn't wearing wasn't a lovely young lady, and I wasn't wearing I had the puppies out. But I used to do that. I used to, all summer, cricket, out on the beach. And do you know why I did it? Can I tell you why I did it? Because I had really bad skin.
No, and you wanted to pigment it up a bit.
Yep. And that helped to remove the and I spent hours out in the sun. In fact, I used to get a bit pink. Right, I used to go and actually get a little bit.
Don't do that.
Well, I had cancers all over my face, and I think I spoke to you about that last time, Doug. Do you remember the one that I had underneath my?
I'll be honest and say no, I don't.
You don't? Well, anyway, I ended up.
So I say to get that checked or something, and I was right, was I?
Yeah, you're right. It was cancer.
Damn, I got it right again.
Yeah, mate. Yeah.
That's one you don't want to be right about.
No, but I mean, it ended up having cancers all over, which is not great. So, but that's my stupidity, right? But you're 100% right. So first thing is staying out of the sun. I mean, obviously, a little bit of sun morning when the UV is a little bit lower is good for vitamin D. But you're right, you don't want to base yourself like a lobster.
But I don't think that sunscreens. I mean, sunscreens don't totally block ultraviolet light anyway. For a start, actually, that's an interesting topic. We've talked about this one, Steve.
Yeah.
When you go and buy your sunscreen, you look at the bottle; it's got an SPF rating on it. Yes. What does that mean?
Sun protection factor.
Yeah. What does that mean?
I don't know okay, let me tell you from a marketing point of view, from a layman's term. I always feel dumb when I'm talking to the bloody professor and the doctor, but anyway.
We don't like professors.
It means effectively for every SPF that you can stay in the sun for that length no, it can't be. You can't say 50 times in the sun. If it's an SPF, you can say 50 times longer before you burn. I think that's what it meant. I mean, I'm just
50
giving
plus.
That's absolutely correct.
Yeah, right. Oh, there you go.
That's absolutely correct. It's not, people often mistake it as a strength.
Right.
And think, oh, if it's SPF 50, it's stronger than an SPF 30. No, it's not stronger. It just lasts longer. And so it has a bit more prolonged protective effect.
But see, I'm actually a pretty intelligent guy. I don't even know how intelligent I are, so most people wouldn't know that. But no.
Congratulations, you're one of the few that knew the answer.
Thank you.
I asked that question to a lot of people just for the fun of it.
Well, I'll give kudos to myself. There you go. I'm not as dumb as I thought.
That's incredible.
But the other thing is, I found fascinating as well too, is that the natural SPF, remember the coconut reef oil and that people used to put on 2 and 4 and what have you. So those do work, but you can literally only stay in the. If you could be in there for 10 minutes, you can stay in there for maybe 20 if you're lucky.
I think the other, I used to do a talk called The 5 Secrets to Good Skin. We won't bother going through it. The first one was don't smoke, by the way.
Yeah. I was going to ask you
catastrophic.
What that was. Vitamin C?
Well, vitamin C is good, but again,
but when you smoke cigarettes, you're depleting vitamin C.
Yeah, well, I mean, when you smoke cigarettes, you do all sorts of terrible things.
Yes.
Vitamin C depleting vitamin C is not the important part. It's creating free radicals.
Right. So it's the free radical
smoking
damage.
is creating free radicals.
And all over the body
vitamin
too.
C opposes the action of free radicals.
So
it's not the vitamin C not working; it's the free radicals being there. That's the problem.
Yeah.
Don't smoke. Clean your skin. Most people are good at it. Girls are particularly good at it. But the next one is the interesting one that I, with modesty, I was again a bit ahead of my time with this one. Exfoliation. It's so important. One of the greatest, and I don't mean this rudely, but one of the great cons is this concept of moisturisers. You go to the beauty therapist, your skin's so dry.
Yeah.
No, it's not. The thing that determines how moist your skin is how much water you drink and how much you sweat and all those sorts of things. It's got absolutely nothing to do with the moisture level in your skin as you feel it, okay?
Yeah.
When people feel their skin and it feels dry, what they're actually feeling is dead skin cells. Because you've got to remember the outside layer of your skin is continually turning over. Not every day, but roughly every 28 days you get a new layer on the top.
Yeah.
And the previous one is supposed to come off, but often they don't. And so when you feel the roughness of the skin, it basically is dead skin cells that you're feeling. So the best thing to do is to exfoliate. And this is the story I always give to people. And with modesty, again, faced a lot of opposition from dermatologists on this subject because they said, no, exfoliating's bad for your skin. And I said, so do you shave? And they'd say, yeah. And I said, with a razor blade? And they'd say, yeah. And I said, well, when you exfoliate with a razor blade, do you think you probably exfoliate the outside layer of your skin? And then I say, oh, yeah. And I say, so have you got terrible skin? No. Right, good. So we both agree that exfoliation is actually good for your skin.
Yes. Actually,
so Steve knows as a dermatologist, I just think she's a genius, this woman. Her name is Zoe Dralos. She's based in America. And she's written a paper, now it's 2 years ago, but she written a paper really strenuously backing exfoliation as being the secret to good skin.
All right.
And saying that skincare products, why skincare products make your skin feel better?
Yes.
It's because they put silicone and stuff like that and it slides.
Right.
How do you tell if your skin's rough? You feel it. If you put your fingers down your face and they sort of drag, then you think, that skin feels terrible. If they go slide straight down, you think, my skin's so lovely.
Well, you're right, because after we shave, I only shave a couple of times a week, right? It's terrible. I can tell I didn't even shave today. But you're right.
I shave for you.
Well, thank you. Well, I feel a bit bad. I'll put a dress on for you later, Doug. Don't worry. But we're kind of like that around here. And Steve, you can put your pants back on. But I was going to say though is that you're right. I think when you shave, definitely, especially if I've got lots of important meetings. Not that you're not an important meeting, Doug, but that you're right. The skin feels good. It's got the appearance of it is obviously better as well too. You're right. The exfoliation part. So, question for you then on that. Like if you've got dry elbows, for example, how the skin all goes all dry. Is that because of a lack of oil? Is that because you're not exfoliating?
Not exfoliating.
Not exfoliating.
Yeah.
We just need to exfoliate more.
No, exfoliate more.
What do you use? Do you use like a
scrub?
Yeah, like
an exfoliating scrub.
Those black cloths that you can get nowadays. And you can use them on your back. And you
loofah. That's the only way you get at your back.
Yeah.
But I exfoliate. Actually, I'll talk a little bit about this if I may, Steve. You know the story I'm going to talk about.
Yes.
Because I've got some interesting news about that. I'm maybe get a research project on it.
Ooh. Okay.
basically, I'll reveal to the people listening, I'm 76 years old, okay? So I was starting to get a problem with fragile skin on my arms particularly. So, I'd bump up against a door jamb or something like that. The next minute I would torn my skin. And,
Yeah, right.
when I'm not doing cosmetic work, I work in operating theatres, and one thing you can't have is broken skin in an operating theatre.
Of course, yeah.
So it was causing me all sorts of grief. And I thought, you're getting old, get over it sort of thing. And then suddenly I thought, wait on a minute. One of the things that I know is that if you exfoliate your skin, one of the reasons why it looks better is because it stimulates more collagen in the deep layer of your skin. Okay, so basically, I got some scrub. So it's one I formulated for a company a few years ago.
Yeah.
And I got some of this scrub, and I had it in the shower, and one of those little rubber things with the things on, and I started exfoliating my arms every day in the shower. Okay.
Yeah.
Now, not a problem.
Is that right?
Stopped it. Not almost completely straight. I still bump my skin occasionally, but it doesn't tear anymore.
There you go.
That's incredible, isn't it? Just a simple thing you can do. I mean, and this is what I think people listening would be fascinated by.
I love it.
What you can do just to help yourself, just simple exfoliation.
Well, yeah. So question then, on creping of the skin as you get older, would exfoliating help to reduce that? Because I hear a lot of people, talking about as you're getting older, obviously, wrinkles and creping of the skin specifically for women on the upper arms.
Some of that is very difficult to fix, but so that would help on the upper arms. On the face, you also allow for movement,
Right.
So facial muscles moving and bending the skin all the time.
Yep.
All those sorts of, and sun damage. A lot of vertical lip lines on ladies' lips have got to do with smoking and sun damage.
Yeah. Oh, yeah. Is there much you can do about that?
Look, if in its mild form, you can use fillers, which we haven't talked about yet, but there's a limit to how much you can do with fillers. Eventually you get to a point where you just can't keep using them because otherwise you're going to make the lips too big and it's going to look stupid.
Yeah. That doesn't stop some people, Doug.
We're happy to talk about that subject because I agree with you. But the other technique is called laser resurfacing, which is basically a technique where you literally destroy the outside layer of the skin and the upper layer of the deep layer of the skin, for want of a better term, the dermis. Dermis is your deep layer, epidermis is your outer layer.
Yeah.
You completely take the epidermis off, and then you get into the superficial layer of the dermis, which is where all the collagen is made, and it reforms new skin and new collagen, and it's typically fairly smooth.
Wow. I like that. I've got bad skin.
It's a real downtime procedure.
I've got bad skin and I've got lots of sun damaged skin, and I'm probably going to pay for it more as I get older. So I'll be coming down to see you, Doug, and we can work out a little plan for myself. But how do you rate like the different lasers that are out there? Because I appreciate there's so many different. I mean, and how do you feel about dermabrasion? And there's like new. Little things that they use now, like little scrubbers as well too, which kind of sounds just like exfoliation, really. What do you rate? Do you rate them? What do you rate higher than others, depending on what sort of thing you're trying to treat? I mean, what's your opinion on all that?
It's just a funny question to ask because it's sort of relevant to my career.
Yeah, right.
I don't know if you knew that when you asked the question, but it is relevant to my career.
Question.
Yeah. No, I didn't.
I came to the Gold Coast in 1996, and I was working in a practice. I won't name where it was, but it was in a practice. And I was in this practice one day. I sort of had a surgery downstairs and some treatment rooms and various things upstairs. And I went upstairs, and there was something going on behind a curtain. I was sort of mildly curious as to what it was. And inside was a lady whose name I must have said I can't remember. But she was doing a microdermabrasion treatment on a patient, which I'd never seen it done before, didn't know anything about it. I was very new to cosmetic medicine at this stage. I'd been going for a very short period of time, probably a year or so. And I remember sort of saying to her afterwards, can I talk to you about what you're just doing after you finish? I'd like to know a bit more about it. So I said, what were you trying to explain the machine to me? So the machine basically had a flask full of aluminium hydroxide, yes, aluminium's hard, they're hard crystals. And what this machine did was to blast the crystals onto the skin and at the same time suck them back up again. So it was, it was like sandblasting.
Yeah.
Okay. And the machine was called microdermabrasion. Okay. And I said to her, so what do you use it for? I mean, do you use it for acne? I'm passionate about acne. Sure. As soon as I saw this, I was like, oh, that's perfect for acne.
Yeah.
So she said, oh, no, we only treat acne scarring. I'm thinking, no, you should treat acne with them. She said, oh, no, you can't do that. That's not for that purpose. So anyway, cut long story short, I eventually ended up buying one of these machines. Would you believe it cost me $25,000 in 1996 and weighed about 40 kilos.
Wow.
It was massive.
Yeah.
But we started using it in my clinic to treat kids with acne.
Yeah.
And it was magic because it's a vacuum cleaner.
Yeah.
It's sucking out all the blocked up pores and getting rid of and opening them up and draining them properly. There was a magic technique. So I'm a big fan of microdermabrasion. I used to, in my days of, I don't know if you know, I had a skincare product business at one stage.
No.
Oh, okay. I did. It's still around, but I don't own it anymore. I won't name it.
It's very popular. Can we name it?
No, don't name it.
Don't give me any free press. I don't mind.
No,
I mean,
that's
but
fine.
we're going to have people write in now. Don't worry. Steve will DM you. Anyway.
How did I get there? I forgot. I've lost my train of
You
thought.
were talking about microdermabrasion.
Microdermabrasion and acne. And we had a very big practice when we used to do quite a huge number of patients for treat acne with microdermabrasion and proper skincare. We actually, there's a long story about that. I won't go into why I ended up developing the products. It's basically because I couldn't get the ones I wanted from America. So I thought my practice manager brilliantly said to me one day, why don't we make our own? And I thought, that sounds too hard. And suffice to say, we did it together, and she still owns the business. I don't anymore.
Wow.
But one of the products we designed was a scrub. Actually, the first product was a scrub.
Right.
The first product.
Right.
Second product was a cleanser, because the scrub and the cleanser aren't all that much different.
Yeah.
So it went on from there. And then there was a moisturiser and blah, blah, blah.
Incredible.
That's awesome. I love it.
That's right.
And one of the great myths with acne, of course, is diet and acne. And we briefly talked about it before. The paper published in JAMA, Journal of the American Medical Association, where they tested whether chocolate causes acne, and they basically said, nope, doesn't. They said, nope, ingestion of high amounts of chocolate did not materially affect the course of acne. Basically, they said that in brief, that foods that adversely influence skin is ancient and deeply rooted. So in other words, it's flawed. And they said that as regards to clinical studies of the influence on diet on acne, perhaps the less said, the better.
Wow. So shut up. You don't know what you're talking about.
They were ruthless.
Wow.
So you want to talk about that for a minute?
Well, it's funny because when I was younger, I used to absolutely swear black and blue that when I would eat chocolate, lollies of any sort, honestly, but and again, confirmation bias, it seemed to be a perpetuation. Chocolate was the worst. I used to feel it really was the worst. I'd eat chocolate and literally the next day and the day after, my acne would get worse. I would swear black and blue. Is it true?
Yeah. No, it is. Yeah, the story of this paper I was aware that it existed, but Steve, being the great researcher, actually got the paper for me. The first thing I have to tell you is that one of the authors I know personally. I actually spent a week in his practice in California. Jim Fulton. Now, what's the other guy's name? Because he's quite famous too.
Gerd Plewig.
No, that's not
and Albert Kingman.
Yeah, King.
Albert. Klingman.
Kligman's formula. He's famous for a formula called Kligman's formula, which is it's not recalled for treating pigmentation.
Topical
in the skin,
sort of thing?
topical treatment for pigmentation. Okay. Kligman's formula. So they're fairly, august. But suffice to say, Steve knows the story, and he was the one who showed me, because I've actually made mincemeat of dermatologists with this story quite a few times, because they still don't accept diet as being a factor.
It's amazing.
And when Steve showed me the study, and he picked it up very quickly. It was a placebo-controlled study. So, the story for our audience who don't know what that all means, you've basically got your chocolate bar in one hand and the stuff that looks like chocolate, tastes like chocolate, but isn't chocolate in the other hand. And you compare the two and see whether there's a difference. And the answer in this paper was there was no difference. Okay. But of course there was no difference, because the placebo was full of sugar.
What, it just didn't have cocoa?
Just didn't have cocoa.
Oh, my God.
Brown colouring.
For crap's sake, right?
So surprise, both of them had the same adverse consequences with acne. So it actually proved that sugar causes acne.
You know the funny
it's one
thing
of the
is,
factors that causes acne.
I've heard these sorts of double-blind placebo-controlled groups before, and it's just like it's exactly the same thing, almost exactly.
But the medical profession has been quoting, and I used to quote it in fairness, until I met Stephen. Not that particular paper, but just the concept that diet had not been shown. And Stephen got up on my whiteboard as I was telling you and showed me why I was wrong. It's terribly hard to put
Melnick paper.
So why does sugar affect acne so badly?
Do you want to do it, Steve?
Yeah, sure. Okay, sugar, you have to, when you eat sugar, it raises your blood sugar level of sugar, okay?
Yep.
The body can't tolerate that. It wants to keep it below 6.
Yep.
So it releases another hormone called insulin.
Yep.
Okay? So insulin lowers sugar. We'll keep it simple. Now, insulin binds with growth hormone to form insulin-like growth factor 1.
Yep.
Which grows shut basically the pilosebaceous units in the skin. So you get a buildup of oil in the pores of your skin. And then you get a bacterial growth in there, a fat-loving one called QT acnes or propionium bacteria acne, and you've got acne.
Yep.
Now, IGF-1 is the bad one I was telling you about. That's also found in milk if you drink milk. So if you have chocolate
And
milk, which is like a chocolate bar that has milk in it, like this has milk solids, you're going to get double whammy. And that's why you're bad on normal lollies or candy for the Americans, but you're
really
very
bad on chocolate.
on milk
and that's,
chocolate.
I know what I always go. Quite a bit of pay on lollies, but
Yeah.
really bad on chocolate. That's interesting because the other thing, and I don't know if this comes into it, could be completely wrong. And again, does sugar reduce the immune system? Does consuming copious amounts of sugar?
I think it causes inflammation.
Yeah,
more
it
than
does
anything else.
cause inflammation. And sugar, when it gets into glucose, is very similar to the molecule ascorbic acid.
Right.
In fact, most animals can make ascorbic acid out of
we can't,
glucose.
yeah.
We can't.
Yeah.
And monkeys and guinea pigs and a few other things.
You
But
might be able to.
I might, well, of course I can. But
You're closely related to the gibbon.
so
Or a
the sugar,
baboon.
the sugar does drive inflammation in the body, which is a dysregulation of the immune system, we'll call it, because it breaks apart inhibitory kappa kinase from nuclear factor kappa beta inside the cells, which triggers all the inflammatory cascades, basically C-reactive protein, interleukin 10 and interleukin 6. Actually, interleukin 6 is the bad one, not interleukin 10. So it really is a very pro-inflammatory substance.
Okay, that's
And that's
probably
bad for acne
that's
too.
a little over my pay grade, Steve.
That's
But
all right.
thanks
The
for that. I
nerds out
appreciate
listening
that.
might
I think
know.
the thing we should finish up though, Steve, though, is very important here because it's not just sugar that's the problem.
That's right.
It's carbohydrates.
Right.
Okay. So Steve's got a brilliant slide because when he's done some presentations with me, and he's got a brilliant slide where he shows somebody with a bowl of sugar in the left hand and a bowl of pasta or
Yep,
whatever it
that's
is
right.
in the right hand. And says no difference.
No difference.
It's
Yep.
the same problem.
Goes into it. It's a cup of sugar with a bowl of pasta.
Pasta.
And the pasta is 200 grams and the sugar is 150 grams. Now, the carbohydrate content of pasta is 75. Now, people can say, oh, but it's complex. So, well, once it hits amylase in your mouth and in your pancreas, it's no longer complex, it's glucose in your blood.
Yep.
And so it all ends up like that. Now, it might end up slowly or quickly, but it all ends up like that.
Yeah.
And that drives IGF-1, blah, blah, blah. So if you have a bowl of cereal, and let's say you have cow's milk on it, which is full of IGF-1 and branched-chain amino acids, which can also exacerbate acne to a degree, then you're going to have a bowl of acne. And then you have a cheese sandwich for lunch, you've got a acne sandwich.
Yeah.
You know what I mean? Really, no, it sounds dramatic.
No.
But
I love it.
you might have a chocolate bar, which
Well,
makes things worse.
No, absolutely. And again, I mean,
Yeah.
Hippocrates, father of modern medicine, that food be your medicine and medicine be your food, right?
Yeah, it's incredible.
Fascinating. There's a few more questions I want to ask. I appreciate that we've got a...
We're going to talk about fillers. I think was one of the things.
fillers.
left
Yeah, we
off.
should
Fillers.
up on fillers.
Okay.
So what are fillers?
Okay, good question. Well, we've all heard of SPAC filler, so just start from there. I mean, fillers have been around. If you remember my story of how did I get into cosmetic medicine, it was through fillers because my wife wanted to have, not my present wife, my first wife, wanted to have lip fillers done because she had vertical lip lines. And in those days, we're talking probably about 93, somewhere around about then, so I was still in general practice. The only substance you could use was collagen, injectable collagen. Now, the problem with collagen was that it came from cowhide. So it was they basically got the dermis out of the cowhide and they supposedly humanized it. I'm not sure exactly how one humanizes cow collagen, but apparently you can do it. But regrettably, it actually doesn't quite match.
Right.
And so some people had a big problem with allergic reactions and all that kind of stuff. And so you always had to do test doses. So you had to do a test dose first, wait a month, make sure there was no reaction before you actually used the stuff, which was a massive inconvenience. It was one thing you had to get refrigerated, which was a pain in the neck. And But it was a good product, and I certainly used it for quite a number of years. And then in the late 90s, roughly 1999, they brought in a new substance which is called hyaluronic acid.
Yeah.
And hyaluronic acid is room temperature stable and is non-allergenic because it's basically glycosaminoglycan, and you basically can't be allergic to it.
Yeah.
So you don't have to test dose anybody; you can just use it. And that revolutionised it. It just made such a massive. The techniques didn't change, but the product changed, and that made a massive difference. It made it much more accessible and ready, usable, and so on. And then out of that, they gradually, the first product that came out was called Restylane, and it was just a product. There was only one. It was just Restylane. That was all it was. And then gradually, other manufacturers got in, and they then started making different variations of it. So, particularly. The thickness was the key factor, which gave you, firstly, more longevity, but also gave you greater expansion. So basically, if you want to make somebody's cheeks bigger, which is a very common thing to do, you basically put collagen into their cheeks, but you want something that lasts a long time and absorbs a fair amount of water, because remember, hyaluronic acid can hold 20 times its weight of water, as I recall.
Right.
You basically want it to have as much holding power as possible. So what they do, hyaluronic acid, as you know, is basically just a long chain of carbon and nitrogen. And what they do is called cross-linking. Don't ask me to explain cross-linking, other than I say to people, think of a ladder. It's got two sides and cross steps, and basically that gives it the stability. The more cross-links you put in, the longer it lasts, but the harder it is. So there's this compromise.
We had this problem with our bars, our collagen bars that we're making. We had a problem with cross-linking. We remove the cross-linking, they're soft, and you have the cross-linking and they become hard. Different but same.
The same principle. So basically now there are goodness knows how many varieties of hyaluronic acid out there, but I would basically not use anything else but hyaluronic acid these days. Are there other things which are non-hyaluronic acid based? Yes, there are. There are two more sort of things to talk about. One is what they call tissue active substances. These are things that when you inject them into the face or wherever, they tend to stimulate a reaction in the tissues, which results in more action, more collagen being created in particular. Okay, so it activates the fibroblasts to start making more collagen. All right, and there's two particularly that are used for this purpose. I'll name them in a sec. But basically, that's a good idea because it's not. I mean, eventually the effect will wear down, but they'll last a much longer time.
Right.
And they're supposedly natural in the sense that it's your own collagen, and that's all well and good and true. But basically, there's always a but. And what's the but? And the but is this. What's this business about making more collagen? And the answer is it's basically an inflammatory response, and it's the body's way of dealing with this foreign body. It attacks it and creates an inflammatory process, which is not painful or anything, but nonetheless, it's ultimately ends up, for want of a better term, in putting in scar tissue, okay, but not in that sense of the word, okay. It doesn't, but it can, and that's the problem. With some of these tissue active substances, if they get into the wrong layer of the skin or they're not placed deeply enough, and so on, you can end up getting nodules, which is your body attacking the stuff, trying to get rid of it.
Wow.
Okay.
So you don't want that.
Yeah, exactly.
And remember, hyaluronic acid, for those people who don't know, is naturally found in the human body. It declines as we age.
Well, it's funny. I mean, you mentioned obviously the lip smokers and people too much sun, but men and women when they age as well too, they lose the chipmunkness on their cheeks, if that makes sense, right?
Basically aging, that's one of the most interesting things. And I always start off with that. If I get a patient who's, 50 plus, which is a pretty common age group in my practice, so they'd be maybe mid-40s and over, is that the first thing I look at is their cheeks, because that's one of the first places to cause to lose volume. Yeah, right. Because aging is a twofold process. It's a loss of subcutaneous fat,
yes,
okay, but it's also a shrinkage of the bones. And we didn't know that until MRI magnetic resonance imaging scanning was the thing that helped, because that MRI came in. I was still in general practice when MRIs came in, so that's late sort of late 90s. And so there are people around who are in their 20s and had MRI scans of their face that were still available because it's digitized and all that sort of thing. So they're actually able to take sequential MRI images of the same person. You can actually see the bones changing shape and moving position, particularly the mid-face bones.
Jeez.
So, sorry.
All right. So there's not much you can do about that.
No. Well, you can hide it by putting fillers and things in.
Well, it's funny because
the reality of aging.
I had no idea what fillers were when I hear of, she's, he or she's had Botox or and fillers. I never knew what a filler was. I was sort of imagining some sort of synthetic sort of Matt, you're nodding your head as well too, right? I mean, I thought of something as being completely weird and synthetic, right? But it's actually collagen. I didn't know that. But I mean, again, it's
collagen is rarely if ever used now because of the it's all hyaluronic acid.
But which doesn't sound so bad, but you're still saying probably has some issues.
Well, the only issue from my point of view with hyaluronic acid is it doesn't last very long, and patients have this expectation that they'll need one treatment and that'll be the end of it, and that's not the case.
Right.
But again, we talked about the longevity effect with Botox. There is a longevity effect with hyaluronic acid.
Okay.
But it's an interesting one, which I certainly never understood until somebody eventually discovered the reason. It's quite fascinating. Basically, when you inject a filler, obviously you're stretching the tissues, right? So you're expanding them. How do you do that? By putting pressure in there, yes?
Yep.
Okay. The fascinating thing we found out was that fibroblasts respond to having pressure put on them by making more collagen.
Well, there you go. There you go.
So what I always say to patients is that, look, what you should visualize in your mind is that you're going to need 3 or 4 treatments over a 12-month period.
Yeah.
Okay. And then you'll find you won't need any for 4 or 5 months. And then you'll find you won't need any for 5 or 6 months.
Right.
And eventually you won't need very much at all, period, because you'll regenerated all this filling volume in your face.
Now, we've got some questions that we need to ask Doug from some of our listeners
as well.
Some of
them one of the questions I got from the girls in the series is what credentials do you look for someone? You're an expert. You've been doing it for 25 plus years. You work at Rejuvenate in Robina on the Gold Coast.
Rejuvenate Cosmetics.
Yeah,
Rejuvenate Cosmetics.
That's it. A bit of a plug there.
Yep.
Mondays, don't you?
Yeah, on a Monday.
Yeah. I'm coming down to see you.
Yeah.
I'm getting the whole work.
Oh, you're the whole work.
I get to pick.
I hate to say, you see women say that, I just want the work. So it's like, well, that's not going to happen.
Well, Steve's been telling me about a new surgery. I don't know if you do it or not. It's very select, but it's called an addictomy. Have you heard of those?
I'm first for that one.
Okay, all right.
Jeez. All right, question.
How do you pick it? How would you
pick a competent?
Look, I think that's extremely difficult. I don't care what area of medicine you want to talk about. There are very good doctors and lots of them, and there are some who are very average, sadly. And how do you pick them? It's not easy sometimes. Often they can have lots of letters after their names but still not be competent. I guess that from my perspective, the first thing I would say is what academic groups are there, or colleges and so on that are involved in this? There's quite a few. There's ones that have been around for a long time, like the College of Surgeons with plastic surgeons and so on. Though some cosmetic surgeons are not plastic surgeons; they've trained in general surgery, which is perfectly sensible. So there's those sort of organisations. Again, dermatologists, because we talk about our story of Botox. Dermatologists was part of the background of that. So dermatologists have certainly been involved in cosmetic medicine, but probably more from the skin point of view rather than from the fillers and the tox and that sort of thing. And then from those groups, a few sort of general practitioner type people like me, and started getting interested in doing cosmetic medicine and particular fillers and tox and all those sorts of things. And we formed initially a society, of Cosmetic Physicians Society. And I'm proud to say that we eventually did what I recommended at the time when it was formed, which was back in about 1990 something. That we formed it. I wasn't the driving force behind it. I was obviously a doctor in Western Australia was the driving force behind it. But I wrote quite a detailed letter, and she and I have been very close friends for years, but suggesting the structure for it and saying that we should have an ambition to turn it into a college with training and all those sorts of things. And there now is a college called the Cosmetic Physicians College of Australasia.
Yeah, right.
And I, with modesty, was the inaugural president thereof.
Wow.
And now a lifetime member.
And again, you want to make sure that you're, I mean, especially if you're going to go and have surgery. I mean, you can't, well, you can obviously go correct it, but you can't unhave the surgery, right? So, anyway, what are your thoughts, Doug?
It's a very difficult, you've brought up something, and I'm probably going to be careful about what I say here, but it's something that's very dear to me. And Steve's reaction was,
I know what you're going to say.
Yeah, exactly. But one of my concerns about the medical profession, and it's all got to do with lawyers, is that the professional bodies such as the colleges of X, doesn't matter which college, they have underperforming members in their who are fellows of their college, and they know they're underperforming. They know they're dangerous. They know they're incompetent, but they don't do anything about it.
Why? Because they're afraid of being sued.
Afraid of being sued.
Right. So the problem is then, and I guess they're probably more afraid of a lawyered up doctor that says you're damaging my ability to earn income because you've destroyed my reputation.
Well, doctors have all got medical indemnity insurance, and that covers things like that. So it's a very difficult area, and I think it needs to be tidied up. It really does. I mean, I'm not particularly fond of the bureaucracy that's involved with medicine. I don't think they necessarily do a particularly good job. But yes, I think the colleges should, and I'm actually the chairman of the membership committee of the college still.
Okay.
And so we actually vet people quite carefully. One other organisation, there's a thing called the Australian College of Cosmetic Surgery, which fights long and violent battles with the plastic surgeons all the time, because plastic surgery, I'm going to be a little bit rude about plastic surgeons for a moment. Plastic surgeons, if you go back to the 50s and the 40s, they were very opposed to cosmetic surgery. Most cosmetic surgery, as in surgery, was nose jobs. Okay, people had noses that they didn't like, and they would go to ear, nose, and throat surgeons who would do rhinoplasty to try and correct and give them the nose they wanted, whether not necessarily the deformity they had. If they just their nose was too big or too small, the tip was dropped or whatever, they would want it clean. And the plastic surgeons were incredibly derogatory of this, because they were all about treating people with burns and plastic surgery originated out of the Second World War.
Well, I was going to say, what is a plastic surgeon?
Plastic reconstructive surgeon. So these are the people who put people back together who've been smashed.
But why do they call it plastic surgery?
Well, plastic because it's malleable, I guess, would be the answer. You can change the shape and the form of it quite readily.
So do they actually use plastic?
No. No, they don't.
You can see now Doug's going, why did I come on this podcast?
No, but you've got to think of the word plasticity and what that means. Plasticity means adjustable, changeable.
Because I've never known why they call them plastic surgeons. Because cosmetic surgeon and plastic surgeon, I'm like, do they use plastic in their surgery to reform? Shut up, Steve.
Well, they're called plastic and reconstructive surgeons. And in
it's
fairness,
because it's the plasticity. Is that what you're saying? Be able to mold and change.
Rechange them. And some of the skills that they have are amazing. I have a privilege of doing some work with a very, very sad situation with patients who are having breast cancer surgery. And occasionally we will have a plastic surgeon in the theatre as well.
Yep.
And we will do the treatment of the cancer side things, and then the plastic surgeon will do a reconstruction and recreate breast. And, some of the people I watch do that, it's like, wow, that is seriously amazing work. Really, really terrific. But the big argument was that plastic surgeons were very anti-cosmetic surgery until, guess what? Ding, ding, the money.
Yeah, of course. Show me the money.
Show me the money. And I always remember, botulinum toxin was, I could tell lots of stories, but I could tell, Botox has been around for quite a while, and the plastics weren't using it at all. I had a colleague down in Sydney who, I was talking to him about it once in relation to laser resurfacing, and he said, what do you want to use that Botox stuff for? She just cut the nerve.
Cut the nerve?
Anyway.
And he used to probably amputate legs with a saw as well. Too.
But suddenly, Botox suddenly just took off like a rocket due to internet and all these other things, and all of a sudden the plastics thought, whoops, we're missing out here. And before you knew where it was, I think he was then president of the Society of Plastic Surgeons down in Melbourne, put out a press release saying that only plastic surgeons should inject Botox. You had to have a detailed knowledge of facial anatomy.
It's great. As you said, you can make a bit of money.
Yes, there's a war going on at the moment between the plastic surgeons and the cosmetic surgeons. And so I was telling Steve the story that I was actually in theatre a couple of months ago now, and there was a patient who was having breast surgery for cancer, and I noticed that she'd had a what's called a breast reduction done, and without getting into too much details, her scarring was the worst I've ever seen. It was done by a plastic surgeon.
Wow.
So they're not perfect either.
No.
There's good ones and fantastic ones.
Yes.
So I've seen some fantastic ones. Steve knows I had a skin cancer on my cheek cut out by a guy down the Gold Coast.
Really?
And he did the best job I've ever seen. As soon as I took the dressing off, I thought, that is perfect.
Wow.
Sensational piece of plastic surgery.
Yeah.
And that's classic plastic reconstructive surgery. We don't take skin cancers and things off without leaving scars. Some of the reconstructive stuff is just really incredible. But the thing that I was wanting to emphasise is a little bit about surgery is, and I always like to talk about Michael Jackson because I think this is probably as good an example as I can use.
Did he have some surgery, did he? It's just a joke.
I was going to say that, dropped my jaw. The thing that I always say about Michael Jackson is that it wasn't Michael Jackson that caused the problem. It was the surgeons who did the job. And they were doing it because they wanted to be able to say that they were Michael Jackson's plastic surgeon. He had multiple surgeries where doctors, you have a professional responsibility to say no in certain situations. Say, this is not an appropriate treatment. I am not willing to do it, and I advise you not to have it. That's the sort of thing that we should see, and that doesn't always happen. And it's not just cosmetic surgeons who fall into that trap. I've seen the same thing with plastic surgeons.
Yep.
Wow.
So it's a fault in some doctors that they don't know how to say no.
Yeah.
But it
right,
raises a question. When's too young for any sort of cosmetic work?
That's a seriously good question.
Yeah.
I guess the answer is that it depends. Well, you can't have a broad sweeping generalisation. You've got to say, what is the problem that you want me to deal with? Okay? So you could, for example, have the girl we were talking about earlier with the strawberry nevus on her face. I mean,
sooner rather than later.
Yeah, sooner rather than later, exactly. This is life-changing type stuff. If somebody came in and said, they were 16 years of age and they'd been watching whatever their favourite TV show, and they came and said, I want my lips to look like so-and-so, I'd be saying no. With getting a little bit political or whatever it is here, or emotional, I am very fearful, particularly for young girls, and I have two granddaughters who basically are being fed all this stuff, and it's all about their body image. And I go to shopping centres and see girls wandering around with very little clothing on, trying to show as much of their body as they can, and I think that's very worrying.
It is,
and it's not right. So it just depends on the situation. I mean, I certainly, in fairness, have to say, because mother came home with daughter. The daughter was over 18 years of age. She wants to be a model, and she wants some Botox.
Right.
Cysport, what I use.
But would she have any wrinkles?
She just wanted to prevent. She had a frown line.
Oh, okay.
And she felt that was going to adversely affect her photographic modelling.
Okay.
And that's fair enough. I treated it. I thought about it.
Yep.
I thought, you're right on the edge from my point of view. Which way am I going to go here? And because the mother was there and the girl seemed quite sensible, and I've subsequently followed up with her quite a few times, and I've been happy with her attitude and the way she's going. She's not getting crazy, so I'm happy. But if she came in and said, I want you to pump my lips up, I want you to pump my cheeks up a little bit, no deal.
Yeah,
sorry,
go
I don't do
else.
that kind of stuff.
No, that's good. Any unusual requests for things where you just go, my gosh, that's strange? I mean, Steve and I were talking about it, and he was asking for a friend about penis enlargement, but we said that it doesn't actually do anything. It's just all for show, so that you can impress the boys in the locker room.
Yeah.
What's the point of that?
Actually, in fairness, if you want to know what's some of the worst things I've ever seen, a patient who had a penile enlargement would definitely be on the list.
So in terms of botched surgery, I would not let anyone, I mean, what? Yes, hey, take a razor and have a crack. It's like.
Should we put a warning up here?
Just don't do it. But I mean, seriously, I'm not even really sure what's involved in it. But yeah, I do feel sorry for guys with really little wee tackers because, I mean, there's not much you can do about that, is there? No.
It's genetics.
Yeah.
You get over it. Move on.
So what did you see? What was the?
Oh, it was deformed. It was sort of permanently disfigured and bent, and
even when it went up, it was like that.
I don't ever think I went that far. I just saw it at the stage when it was at rest, and it was deformed at rest.
Oh, yeah. It's like no,
and a very unhappy patient.
No, I bet.
Oh my goodness.
Yeah, Stephen said, do you like chicken, Jeff? I said, yes. He goes, check this out. This is foul. I said, it's Steve, stop it. But no, is there nothing else like that? I mean, because, these are life-changing decisions that people are doing that are having, I mean, I think of Paul, and I think most people think of Paul Michael Jackson and go, mate, you're a good-looking guy. What were you thinking, right? I mean, I'm sure you come across this all the time, and people and going to other surgeons and getting stuff that you wouldn't do, coming probably to your help for rescue surgery, right?
Well, yeah, I don't do much cosmetic surgery. I'm mostly cosmetic medical type treatment, so not a lot of surgery. I basically used to do blepharoplasties, which is eyelid surgery, upper eyelid surgery, liposuction, that sort of thing, but not facelifting or boob jobs or anything like that. I just wasn't interested in doing it.
Yeah.
Now, I've got to ask you one final question over time. Have you ever watched Botched on television?
He knows the answer. My wife's an addict. She loves
it. Does she?
So I sit down and watch it occasionally.
We'll explain what Botched is, I guess.
Okay, for those who have not watched Botched, there's two guys in America. They're both plastic surgeons. One tends to specialise in nose surgery and the other one in breast surgery. but they're basically reconstructive surgeons in the plastics in a cosmetic sense.
Is it real or is it a?
No, it's real. Their specialty is fixing up the botched jobs of other people.
Wow.
And I would love to emphasise the fact that most of the botched jobs are not done by cosmetic surgeons, but done by plastic surgeons.
Wow.
But putting that to one side, which is a bit bitchy on my part, sorry, plastic surgeons.
If you're listening to this, you're one of the good ones. So not you. We're not talking about you.
But yes, they basically get people who've had really, really bad jobs done, or in some cases, people who've got sort of congenital abnormalities and things like that, and do reconstructive work. And the first comment I always make when I talk about Botched is they only show you their good stuff.
Yeah, of course.
Everybody's got bad stuff in their closet. They don't show you that. They show you the good stuff. But some of their good stuff is
pretty good.
Extraordinarily good. Just like, oh man, that is so clever. I saw them do a massive skin graft on reconstruct somebody's cheek the other night because I was watching it, and the job was just sensational. It was just, unbelievably good. I can tell you a story of a local plastic surgeon. Sadly, he left town now, which is sad. But I had a patient come and see me cosmetically, and she mentioned to me, because I was going to put some tox up in her brow area, that she'd had a skin cancer taken off her nose and had what's called a glabella flap. And for those listening, basically you sort of put your hand between your eyebrows, that's your glabella. And that skin there is quite mobile. You can move it around very easily. So you can actually lift it off and move it down and transfer it down onto the nose as a graft.
It's like a Mohs surgery, is it?
Oh, no, Mohs is different. I'll tell you about Mohs surgery if you're interested, but it's different. So it's called a glabella flap. It's because it's got its own circulation. They tend to do very well. You can put the full thickness. You don't have to do partial thickness. You do full thickness. And she said, yes, I've had this glabella flap and full thickness graft. And I said, really? I said, do you mind if I have a close look at that? I can't see anything. So I got my magnifying loupe, which gives me 4 times magnification, got up really close, and I could not see any evidence whatsoever of that work.
And this dude's left town.
And he's certainly left town. He's also, I've seen him in operating theatres doing breast reconstruction. He's seriously good.
Wow.
But anyway, we've lost him, unfortunately. That is a shame. But so that's the sort of level of surgery I've seen on Botched a couple of times. But as I always say, they only show you their good stuff.
Yeah.
They don't show you their best stuff.
Well,
their bad stuff. Sorry.
Steve took you down the salacious. I'm going to take you down the other good route. So I love that story about the lady with the strawberry. Have you got any other good news stories like that to leave us with? I
think the one that I would tell, because Steve's part of the story, is a patient that I have in a country clinic that I do. I do a little trip out in the country once a month doing cosmetic work. And this young lady came in to see me. She was aged 20-ish at the time, 1920. And she saw a little sign outside. I work out of a beauty therapy salon up there, which is sort of the most convenient place to work from. And she saw a sign up that I was going to be there, and she came in and asked the lady who owned it, was there anything that I might be able to do to help her with her acne? And so the person who owned the salon knew that I was very passionate and interested in acne, and so she said, I'm sure he'll see you. So I saw this girl. And her story was that she was bipolar, so she had manic depressive disorder, bipolar disorder. She also was deaf in one ear and had a hearing aid in it. She had very bad family background, alcoholism and all sorts of issues, lived by herself with her pet bird. But I just felt very sorry for her. She had horrendous acne, just not as bad as it gets. I've seen worse, but not many.
Right.
And so I said to her, yeah, I can treat you. And I'm not blowing myself up, but I was happy to treat her for nothing.
Yeah.
Didn't ever charge her.
Yeah.
My wife used to do microdermabrasions on it for free. And we used to buy skincare products for her, and we'd buy all sorts of things for her.
Yeah.
But my biggest worry was, because Steve had, by this stage, had convinced me about diet. I'm thinking, I don't think this girl's got the intelligence to do what I wanted to do. She just won't be able to stick to a diet.
Yeah.
So I spent a lot of time talking to her. We actually took her down to Woolworths or Coles and bought food for her to show her the sort of food we wanted her to eat. And anyway, so she started on the diet, and I always remember she rang me up after a month. I was just about to go back up there, and she rang me up and said, nothing's working, it's not any better. And one of the things I would say to people about acne is the way you assess improvement in acne is not by the redness of the skin, which is the last thing to disappear. It's the lumps.
Right.
It's the bumps. If the bumps are disappearing and getting less and less and less, then you've got less active acne. And eventually the redness will go away.
Yeah.
So anyway, when I saw her after a month, I was stunned by how much better she was.
And that was just through doing mainly the dermabrasion?
And skincare.
Right.
We bought the skincare products for her
This is the ones
and antibiotics and all that sort of stuff.
Yep.
And as I say, Gail used to do microdermabrasions on her and what have you. I think she did little chemical peels and all those sort of things. And after 3 months of doing that, I promise you her skin was completely smooth. She had no active lesions whatsoever.
It was freaky.
Oh, wow.
Like it was different people. Like or it was amazing. Absolutely phenomenal. Sort of goosebump stuff.
There's an more interesting part to the story. So we got her completely settled down, but we sort of stayed in touch. She used to drop in and say hello and all that sort of thing. And then all of a sudden she went bad again. And I thought, what's going on? And of course she'd gone off the diet. But she also had some symptoms consistent with leaky gut syndrome. Do you remember that, Steve?
Yep.
And fortunately she went to a naturopath in the town, I won't name the town, into the town, who beat her up immediately about the diet and put her back on the low carbohydrate diet, and the acne completely went away again.
Oh, that's amazing.
And the thing that I always remember the most about talking to her was, to sort of say to her, you're obviously a lot happier and so on. I could see it in herself. I said, what difference has this made to your life, that we've got your skin better? And she said, when I talk to people, they look at me. Previously, they wouldn't look at me.
Wow.
You think about living life without people looking away as they talk to you because they can't stand looking at you.
Yeah. That's amazing.
And that's making a difference to people's lives.
Oh, that's huge.
And in that case, I did it for nothing.
Yes.
I didn't make any money out of it, but I just loved doing it.
Yeah, and the funny thing is, I guess it wouldn't have made it any more sweet. It probably would have made it not as sweet for you as a memory. If
I charged for it,
and that's awesome, Doug. I mean, I love that. That's a great story.
It's amazing. Pictures are amazing, and that's naturopathy or natural medicine and orthodox medicine combined. Beautifully. That's how it should work.
Thing. Yeah, that's exactly right.
Well, that's the thing that I love so much about what Steve taught me, was because diet is so fundamental. I mean, one of the things that we haven't talked about is my surgical work that I do, which is mostly in orthopedics. And guess what the most common problem is that you see in people who need joint replacement surgery, knees and hips? What do you think is the most common problem?
I won't say.
What, diet?
Well, sort of. What else?
What does a bad diet cause?
What does a bad diet cause, exactly?
With inactivity.
What?
Obesity.
Oh, of course. I'm not even thinking
140 kilos, 130 kilos. I had a 24-year-old who weighed 139 kilos.
Wow.
For an orthopedic procedure, not for a replacement, for an orthopedic procedure, though, who's having trouble with the knees. 140 kilos.
That's a lot of stress on the joints.
It is. It's massive.
Yeah.
And it's because of carbs.
And the thing is, actually, I remember I was talking to, I think it was the doctor that did my knee surgery, and he said, well, when you go back to play football, he goes, if you're your ideal weight, he goes, every kilo over that when you're running, and you'll correct me if I'm wrong, you'll probably correct me if I'm wrong. He said when you're running, puts an extra 7 kilos, on that joint. So if in terms of under stress.
Yeah, under stress.
So when you're running and you're changing direction and all the rest of it, if you're 10 kilos overweight, that's an extra 70 kilos on that joint, right?
Horrendous.
So now obviously we've got additional
I don't know the maths of it, but I don't disagree with what he told you.
Yeah. So I mean, again, the lighter you are, the better your joints are going to feel, and which means that the more active you're going to be, which means it's going to be easier to keep the weight off.
Well, the fat cells secrete a hormone called leptin, which actively destroys cartilage.
Yeah,
and that was only discovered in 2008, I think, was the first paper I read on.
Have we spoken about that?
I think so.
I don't think we have.
Podcasts.
Really? I don't know. I don't think we've spoken about that.
We could do a podcast on the
effects leptin,
of obesity.
So being overweight.
Yeah, I mean, it does other things.
Leptin.
It's stress, physical stress, of course, and being weight. But leptin is a hormone secreted from fat cells that tells your brain to stop eating.
Wow.
It's supposed to be to get leptin resistance if you eat a lot of carbohydrates. That's why you can eat rice and feel hungry 10 seconds later, or lollies. So leptin actively destroys the cartilage. So it's really quite a dangerous hormone secreted from the adipocytes or fat cells.
Wow.
When they're full. Huh. And very inflammatory chemicals and all nasties.
You'd be stunned that, as I often am in theatres, I keep thinking, what do my joints look like? But you'll see relatively young people doing arthroscopies on them, where you can look inside the joint, and to see the loss of articular cartilage at amazingly young ages. I mean, I've been assisting for 12 years now, and the age group for most patients was 60 and above, and it's now down to 40 and above, because we're seeing that level of joint damage. I mean, you look inside the joint, you think, well, there's nothing else you can do. We haven't yet learned how to replace joint cartilage, and until we do, then they're just going to have to keep on putting artificial joints in. But the solution is to get people's weight down. I love the story. I wish I could remember what was in relation to it. It was on TV one night, and they basically had a shot of a street. I can't remember if it was Melbourne or Sydney, but let's say it was George Street in Sydney, the main street of Sydney. And it was taken in 1950 or 45 or something. And there's all these people with suits on and blah, 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 but they're all thin.
Yes.
Not thin as in too thin, thin as in normal.
Healthy, yeah.
And then they show exactly the same street and exactly the same crowd. And it's like, oh, my God.
I saw a photo virtually identical to that. I think it was people walking along the Riviera or overseas somewhere, right? And they're all walking. And you're looking at them guys, girls in their bathing suits. And, of course, the guys wearing the little trunks and all the rest of it. And literally there was I actually don't remember if I saw anyone that was overweight. It showed exactly the same scenario with the people walking around with their togs on, their bathing suits, and almost the opposite was true. It was almost spot the thin person, right?
It's unbelievable.
It's just crazy.
We'll have to get you back to do a general practice one, because we've done a massive.
I'm a bit rusty on that. I haven't done general practice for a while.
That's what it's all about the history of it. It fascinates me. It really does.
There's so much that we didn't cover off on a lot of these things, Doug, but it's always nice having you on, because it's good to have a chat. It's good to find out what's important to you. And I think there's a lot of people listening to this out of interest. There's a lot of people listening out of this for hope. I think there's a lot of people going, okay, maybe I'm not happy with something. And as I said, if you don't like it, go fix it. Go change it.
We just go back. We didn't finish off the conversation about how to pick out the physician you go to. There's one other thing I would put in there. So yes, I would look to what are their qualifications. What are their training background. Blah blah blah. But there's one other thing, and it applies. I always tell this to any patient I refer to a specialist for treatment: is you need to like them.
Yeah, right.
Okay, you really do. You need to like. If you don't like that person for whatever reason, I don't care how qualified they are. Do not go to them, because things do go wrong, and you need to believe and trust the person that you're working with.
Yeah.
And if you don't like them, you're going to make the whole life much, much, much more complicated. And often the reason why you don't like them is because they're not all that good. But yes, always like the person that's treating you. As long as they treat you well and you feel comfortable in their presence, then you've probably found the right person.
Well, I did my knee playing football, lost 11 mils of cartilage, blew out, which wasn't fun, and went and had to go and see a surgeon. And it was actually Steve, and he recommended Doctor Alan. Was it Hadley? No, what's his name again? Bryce Galley. And he was great. He was excellent. But the first thing that you asked me when I saw you, because I haven't seen you since then, was, did you like him? You know what I mean? It's funny, isn't it? But that is important.
It is. It's very important. You need to like the doctor that you're going to, because you won't trust them if you don't.
Yeah.
If you have a negative reaction to them as a person, you'll tend to not trust them.
Yeah.
And there may be a good reason why you don't trust them, and there may be not a good reason. But yes, you need to like the person. And
if in doubt, don't. That's another big one I reckon as well too, especially where it comes to these things. If you're umming and ahhing and have to talk yourself into it, probably don't. Better to be cautious than to be sorrowful. Well, again, I think that's part of being a good doctor. I mean, I spend a lot of my lifetime talking patients out of things, not into. And my general rule, if I am going to treat, is not to try and do everything in one go. I want to do it gradually over a period of time for two reasons. One, because I have less complications. And secondly, if I do have a complication, I'll know exactly what caused it and where the problem is, because I haven't over-treated them. And last but not least, their friends won't notice. Yeah, funny. And I've got one last question, because then I appreciate we've got to wrap this up. Yes, we've been going. It's great. I've enjoyed the conversation. I love it. I'll come back and have a chat. We'll turn the microphone off. Absolutely. I love it. And that's kind of the way that we want to do things. But if there was one thing in the last few years that's come along where you've gone, that's brilliant. Like, obviously Botox was a game changer. Just like the little blue pill was a game changer in performance in the bedroom, right? There's been one sort of breakthrough. I mean, again, we were talking about lasers before. I know that you like dermabrasion, but if there's been something that's come through where you've gone, you know what, I love that. That's great. Whether it's in your field or you've seen it in another field around cosmetics, is there anything that you've gone, that's really great?
I sort of yes and sort of no to the answer I'm going to give you. I would have said robotic surgery.
Yeah, right.
I think the first thing I like to, if we got to say, is that in robotic surgery, the robot doesn't actually do the surgery. The surgeon does the surgery.
Yes.
Okay, but the robot assists. And I was actually in an operation this week where they were doing a shoulder replacement on somebody, okay, and they're doing it using a robotic technique, which I'd never seen done before. And this is a bit technical, but one of the most difficult parts of the operation is you have to put a new cuff on the shoulder, on the scapula, and when they do that, they have to screw it into place to hold it, and the screws have to go exactly where you want them to go. They have to go into the spines of the scapula because that's the only safe place to put them. And typically, before the robot, the surgeon would have to sort of try and feel around the back of the scapula to work out where to put his screw, and he'd sort of have to be careful about how deep he made the hole to put the screw in and all that sort of stuff. But in this particular case, the patient had a CAT scan done, a computerized axial tomography scan done of the shoulder, and that was sitting up on a screen in front of him. The robot basically was linked to that screen, so it could see if you touched the thing with a probe, the robot will show you exactly where on the scapula you were.
Wow.
Okay, so when the guy was putting the screws in, all he had to do was line them up on the screen up there and know exactly how far in to put them.
Man,
Like a computer game.
I could do it.
Yes.
So why is that important? It just made it so much easier
Oh, it's amazing.
for the surgeon to do what
That's
he had
great
to do.
technology.
So it was good for the patient. There's no risk of hitting major blood vessels, which are in that area, and blah, 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 speed of the operation up and all that sort of thing.
Recovery, yeah.
And so I would say that, that kind
Robotic.
of thing makes a difference. I really do.
I really love that story about the robot because at the end of the day, any form of advancement that can obviously make surgery easier, safer, faster, better recovery, that's really exciting. I've heard that they're using it for even doing hair transplants and that now, but they reckon
really?
it's not as good as the original because it's like an artist.
There's
doing
hope
it.
for me.
Oh,
I was
see,
going to
this-
say, it's very artistic hair transplantation.
That's
stuff.
it because
You've
it
got to
doesn't
be-
look natural.
Yeah, the people who are good at it are very good at it.
Yeah,
The
like
people who are,
artists.
the people who aren't artistic are not very good at it.
Yeah.
You can't just stick hair follicles all over the place. It doesn't work.
No.
It looks terrible.
Oh, it's good
Sorry
to
about
know.
that, Steve.
Yeah,
we're going to go down and get a 2-for-1.
Yeah.
We've got a 10% discount over here.
Yeah, absolutely.
What was I going to say? Well, thanks, Doug. It's
Yes,
been
thanks,
awesome
Craig.
having
Thanks
you here.
very
I
much.
Thank
really
you.
enjoy the conversations because there's so much, and literally we only scratched the
I was going to
surface.
say we had a much bigger list than that, didn't we?
Way bigger.
We'll have to get you back.
We've talked about some
you come
funny.
back?
Yeah, I'd love to.
Yeah,
I've
well,
enjoyed it. It's a great conversation. Well, you and I love it.
we love this.
We spend all day yakking to each other. It annoys our
about
wives
science.
immensely.
No, it's great though. But and again, it's two ends of the professional. It's the doctor and obviously the naturopath. I mean, again, Steve, I appreciate that's a bit crude because you've also got a background in chemistry as well too. So.
We're scientists.
Yeah. Yeah. Well, that's it.
Well,
Exactly
I think that's really the key. Thank you, Stephen. I totally agree that Steve and I are scientists.
Yeah.
Well, I mean, I have a science degree, so I'm allowed to say I'm a scientist.
I'm a
But-
scientist.
And that's what gets us irritated the most is when people are not scientific about it, but claim to be. Then they say, we follow the science. There's no such thing as the science.
But Doug, thanks so much for coming
Pleasure.
up. And I was going to say we'll definitely have you back on. And what I'd like to do is maybe cherry pick some topics where you're an expert on, which your breadth of expertise is obviously very wide. But specifically on skin, maybe we can talk about some of the different, fractional lasers. Maybe we can talk about dermabrasion and really get into that. But a lot of people are going to be listening to this, and I'm sure there's a lot of people who have got very bad skin and acne, potentially in Australia. Look, you're welcome to come over from anywhere else in the world now that we've got the borders open. But if they want to find out, if they want to talk to your clinic, if they want to, talk to you about treatment or something like that around acne, how do they reach you?
That's a difficult question. Obviously, you were talking about by email or
By
similar
email,
type
or
things.
do you have a website? Where's your
No, I
practice?
tend to
currently?
hide,
Do
actually.
you? So do I.
I try to
busy
keep
guy.
a very low profile. I mean, I work at a clinic in Robina,
Yep.
and that's obviously it's called Rejuvenate Cosmetics. It has an email, it has a websites and all that sort of
Yep.
stuff, and they can sort of put things through there.
Yeah, great.
But
But anyway, thanks again, Doug.
that's my
Thanks,
pleasure.
Doug.
Thank you for having me. It was a fun conversation.
Yes.
I enjoyed it greatly, and I appreciate the honour of being asked to appear.
Always, we'll have you back. Absolutely. It's
Thank
great.
you.
Thanks.
Thank
All right,
you all.
thanks, guys.
Bye now.